Good morning to all of you. Thanks for coming and attending our IC. So why are we doing this IC at all?
पुराने लड़की की मौत के बाद परिवार के लोगों ने ड्रम कर तोड़फोड़ की। करीब 100 लोगों की भीड़ ने अस्पताल के स्टाफ के साथ मारपीट की और काफी देर तक हंगामा कर
So as this is the situation prevailing everywhere in the country, so how will you deal with this situation being a doctor? You can do like the idea to crush your enemies, or you can be so in search of inner peace. So these are two extreme ways to deal with such situations. So we are not looking for any of them. What we'll try to look in this IC is to look for the middle path. So the chief instructor is Dr. Jayanta Kuila, and our first speaker will be Dr. M. Nishant, who is director of M&I Hospital from Chennai. I will deal with the company dealings, and Dr. Jayanta Kuila will deal how to protect yourself from Consumer Protection Act. He is the director of Shunayan Advanced Eye Institute from West Bengal. Dr. Purban Ganguly will tell how to face the physical, mental, and social media harassment. He is consultant orbit and oculoplasty from AIOC Kolkata, and he is also attached with Shunayan Advanced Eye Institute. Myself attached in Shunayan Advanced Eye Institute and Netralayam Super Specialty Eye Care Center. I'm a consultant of cornea and ocular surface. I'm Dr. Shumana Chatterjee, and I'll tell you about accreditation status, whether it is protective in court of law. We have with us Dr. Seema Mane. She is an ophthalmologist consultant from Nandadeep Seri Eye Hospital in Pune, and she will tell us how to protect the interests of patients. And last but not the least, our star speaker of the day, and to whom we all look forward for advice, Dr. Bhaskar Mukherjee, who is not only a prolific ophthalmic surgeon, along with he holds the post of medical superintendent of Dr. Nihar Munshi Eye Foundation in Kolkata, and he is also the medical legal expert from Apex Insurance Consultant Limited. So he will give us tips how to face the court. So after this introduction, I will give you 3 case scenarios. The first being a 60-year male who had an uncomplicated phacoemulsification surgery, and at glass appointment, he needed a -6 diopter spherical to see 6/6 distant vision. Patient was very unhappy, naturally. He consulted elsewhere, and someone offered him LASIK. So he came back to operating surgeon. The option of IOL exchange at no extra cost was given to him, but the patient and party denied. They not only wants the money back for the phaco surgery, but also wants the money for the LASIK operation. So how to deal with this situation? Second being, a 50-year-old non-keratoconic patient who was advised to continue the old glasses. He demanded a power prescription, and when we gave him, he made a specs of $50,000. Then he became uncomfortable with the new glasses. He went elsewhere for the check of refraction. Only a discrepancy of -0.5 diopter spherical was found, And now the patient demanding compensation of exactly the amount with which he has met the specs. So what to do in this scenario? The third common scenario being a 65-year-old diabetic female who had an uncomplicated surgery, but she developed endophthalmitis after 3 weeks. And she was managed well in-house with intravitreal injections and vitrectomy and every possible thing, but she didn't improve. She was sent for second opinion, but patient party demanded hefty amount as compensation, and they created a ruckus, bringing in local goons. So this is another situation where we are at a loss what to do. So we'll try to find the answers of all these situations from our legal expert after he finishes his talk. Now, to start with, I will invite Dr. Nishant to give his talk on how to protect your own center from such litigations. Welcome, Nishant.
A very good morning to everyone present here. Thank you, Dr. Sumanna, Dr. Jain sir, for giving this opportunity. And I think more than my talk, I also want those answers for these 3 questions. I think that will be a better way to start with. But it was the first time that I had a talk which is non-ophthal, and once I started talking about this, I found out that it was so useful, so thanks for that. And I'm sure with the experts in the panel, they can help us what we have to know better. Because I'm sure as an ophthalmologist, not only as someone who owns an ophthalmologist, but even for people practicing in an ophthalmologist should know about all the legal aspects of ophthalmology. So what about the phase that doctors are next to God, and with constant change in litigation, doctors are under surveillance of justification, and also a deep knowledge and best efforts has to face with many allegations. Gone out the days where I'm sure that all they have to do is say, you have cataract, and they get it done. I think this generation and the next is going to have a tough time where there are always 50 questions before we decide on what treatment we give. And they have their favorite Google says that these are options which are available and why are you not giving them. So I'm sure that whenever still some patients think of us as God, they say that you are God. I'll say, no, I'm just another human being who's doing my profession, because I'm sure that the same patient who treats us as God, the next patient is going to come and accuse us. So please do not think that we are in that level now. What are the threats of litigations? The concerns, the medical care is a noble profession, yes, but it comes with inherent risks, including the potential of being involved in emotional, painful, and expensive lawsuit. I use these 3 words because it does definitely affect you emotionally. It's not only in terms of the amount which is required, but emotionally, the peace of mind and you with your family, with the whole hospital, the staffs, the environment actually goes down. So safeguard your medical practice from litigation by adopting proactive strategies that might mitigate the risks, promote patient safety, and ensure compliance with the law. What are the ways in which we can actually call in the court of law? So we should always think that when we get a legal notice from a patient, for whatever these 3 questions Dr. Sumana put, yes, a patient you give glasses is uncomfortable, can come back with a legal notice. Do not think that this is just a letter which has to be ignored, because if you refuse, and then that will prove that you were made aware of it but not responding, and it must be replied. Not replying amounts to admission, and denying each allegation separately calls summon. That should not be refused. If refused, court may issue a warrant, and then warrant can be a bailable warrant, and police can give bail or not, and finally it goes to a non-bailable warrant. So what we thought is just a letter which has come from the court of law can end up in the court of law in the jail as well. So please do not take any legal notice as light as possible. So you know that we have 2 different types, an emergency and a non-emergency type of people. Yes, all our patients are actually mostly non-emergency. When I went and saw, I thought whether phacolytic glaucoma or AION or an acute this thing. So these also not comes under emergency, because for them emergency is nothing related to eye. It is only heart, it is only acute appendicitis, RTA and all that. And always make sure that you treat them with the best of ability, good faith, reasonable care, and no momentary consideration. I'm not sure, if I'm wrong, I'm sure that my chairpersons can correct me. But if a patient actually comes with a heart attack to an eye doctor, we have no rights to refuse them. I'm legally, if I'm sure. We actually have to make sure what we can do best for them. And what we are doing best for them is referring them. That is the second part. But the first part says that you cannot refuse a person who comes to your hospital for whatever the condition it is, because you're a doctor and they are a patient. So the role of ophthalmologist in medico-legal. So as third-party experts, we have to treat or examine and as legal proceedings against an ophthalmologist. So write down all the document them that so-and-so had come to our hospital. We made sure that we stabilized them. We called an ambulance. So these are the things we are supposed to write. So when a mishap in the form of complication, infection, table death and all that happens, such mishaps are inquired by the government or the police by appointing an inquiry officer. So then ophthalmologist, being investigating officer as an individual or a part of committee, comes across these legal matters. Consent forms. Yes, we all know that the AIOs also have given a lot of consent forms. There was a small incident which I wanted to tell, that in a hospital actually the patient went for menstrual bleeding where laparoscopy was done, which the consent was obtained. But during the laparoscopy, they came to know that the patient had more of bleeding and they have to do a hysterectomy. So this is not something which can be added in the consent. Please understand why I am saying this is, as cataract surgeons, we actually sometimes undergo PCR. Luckily, actually, a vitrectomy is something which can be done along with a phacoemulsification. But if you're doing a core vitrectomy or an intravitreal injection along with cataract, or suddenly the nucleus drops, and nucleus drops vitrectomy is not in the same consent form. Please make sure that this is a different consent form. Do not include it that phaco complications and the next set of consent forms. And make sure it is understandable in their own language as well. And how much of information? Yes, we are used to say that let us keep it minimum. No, try to even include in terms of infection, endophthalmitis, nucleus drop. Let the patient be aware of all this when they are signing. The main thing is effective communication, which reduces the risk of litigation. Ensure you communicate clearly to your patients, addressing their concerns. Encourage open dialogue actively. Misunderstanding or lack of communication can lead to dissatisfaction and ultimately lawsuit. And whenever an unhappy patient comes back to you, never ever say that my other doctor will see to you, whether it is senior. Do not push away the patient. Always be with the patient. The only thing they require is someone to talk to, and they want your presence always to be there with them. Risk management identifies the potential risks, be it simple thing like a slope which is there in your hospital or a ramp. Make sure that you also have a proofing on that, because a patient slips over there is a risk which is for the hospital, because it is happening inside the hospital and the patient can file a lawsuit for that. So anything inside the hospital, we are responsible for it. Yes, we have so great to this AIOs and so many other CME programs, because this is something which we learn. I'm not sure whether I can educate you people, but I learned a lot because of Dr. Sumana, who wanted me to do this presentation. Patient safety. We all feel that this is the utmost priority, what we always want to give to the patients. I agree to that. When we try to concentrate on patient safety, that's why we have the NABH and all that which has come, we will realize that the standard and quality of our hospital increases. And always encourage your staff. It is not only you who should know about it. Your staff, from your watchman, should know about how to respect the patient, any incidents, unsafe conditions or any other problems. Employee training and maintain confidentiality. As I told you, every month we actually have a particular team of infection control team, trauma team, fire team, safety team. So there is a team which we have, and once in 2 months we have meetings. I'm sure that all the hospital with NABH accreditation also follows these norms. That is very important. And the 5 C's: consent, court order, continued treatment, compliance, and communication. So these are the things which has to be followed. As I told you, I think out of all my slides, this is the most important slide, is just listen to the patient when they come back with either a problem or a complication. Because I realized I am a LASIK surgeon, so I had a patient who was -8 diopters. I did a femto 6.6 on day 1. I'm sure that as doctors we'll be more happy than the patient. But the patient was little discomfortable. As what happened? No, my stomach is paining. I said, yeah, it's okay. I mean, but how's your vision, Abdinam? Vision is okay, fine, but main thing, my stomach is paining, Abdin. So I thought, okay, just continue the drops and come back after 3 days. So she came back in 3 days. How are you, Abdin? Still, I'm not happy. My stomach is paining. So my treatment was actually to give her a Pantocid and a Gelusil. In 2 days back, she was so happy. Doctor, my eyes are so fine. I'm so happy. Thank you so much. So that is what I mean by listen to the patient. Please treat what they came for. Please treat the complaint. I'm sure we all have mature cataracts who wants only glasses. Sometimes I tell them that it is not at all required, but still they make sure that they need the glass prescription. Even if it is hand movements or plano, I write them that no vision improvement and I give them the glasses. They are happy. So make sure that it's not illegally what I'm doing. I'm just giving what the patient wanted. Buying is secondary. Always follow an ethical practice. Illegal advertising is not something we should do. Always make sure that you follow the code of medical ethics. Documentation is also very important. I will actually show it in the last slide, which is the most important thing. And yes, we all have EMRs in which the prescription is there, but if you're handwriting, make sure that you follow the norms in which the prescription has to be done. Medical records, yes, professional boundaries. So always don't discuss about your patients in front of them to other doctors and such. So I always like this quote, like, love thy patient, but do not fall in love with your patient. And you have these insurance policies which will be dealt by the next speakers. You actually have a Clinical Establishment Act in which all the details are actually given. Negligence is something which I'm sure that all of us are worried about. It can be there. And what is this? Just last minute. Res ispa liquitor. Anyone has an idea? Yes, sir, you must be knowing. So it says that the thing speaks for itself. So what does it mean? So yes, if you have an X-ray like this, there is nothing which you can do to defend. And if you make sure that you cut your vexel sponge and keep it goes off subconjunctivally after mitomycin for glaucoma procedure. So make sure that don't let the diagnosis or the problem speaks for itself. So these are few laws in India which is relevant in ophthalmology. And in AIOS itself, we have legal aspects in ophthalmology, which is very useful guidebook. And the last final slide of 10 commandments. Please, I would say that whatever is done should be documented. Anything not documented is not done. I'm sure we had all our postgraduates and fellows. He said, did you see the anterior chamber? It was shallow. Yes, sir, I know it was shallow. Did you write it? No, I didn't. Then it is not documented. So anything is not documented is not done. Whatever is documented should be communicated, and anything communicated should be documented. Maintain the records of history, test, diagnosis, well-informed consent, and no manipulation. I'll say, I'm sure that they can justify that. Please ever do not manipulate a case sheet. Even if it is wrong, it is better it goes to the wrong in the court of law. Don't change anything, because they know which ink has been used, they know the date of the paper, they have all the details to check when it has been written extra. Once you do that, there is no defending yourself. Take home message, documentation, prior and informed consent, standard guidelines, ethical practice, legal cells, and ignorita just non exequat. Thank you so much.
Thank you, Nishant. And it was such a wonderful presentation. You did complete justice to the topic. Thank you once again. So next, I will talk on the nuances of handling the cunning companies. We being doctors, and it is equally true for myself also. We try to avoid such situations, but how they can trap us. So, first to start with, what are the ways to procure any instrument for your center? We can go through the tender process, or we can go without the tender process. If you are going without tender process, then you give directly a purchase order. If you are going with a tender process, then you have to give a notice inviting the tender. You have to do a technical variation, and you have to do a expert verification. This NIT is a key document, so it needs a careful preparation. And this technical specification should be non-ambiguous and specific. The tender process can be cancelled at any point without showing any reason to the bidders. And we have to make sure that at least every instrument has at least 3 bidders. In case the first one fails, the second one can be automatically eligible. So this is the dilemma. There is a tender committee for every hospital who sees the technical specifications, and these specifications are verified by an expert committee. Then we start the financial bid. The company we select. After selection, we just release a pay order, and they hand over us the instrument. So a purchase contract document is prepared covering all terms and conditions that have been agreed upon by the vendor and the hospital. The purchased medical equipment should be evaluated from 3 different angles: technical, clinical, and financial. So once the equipment comes to your hospital, we should verify the accessories, we should verify the manuals, electrical safety and operation in accordance with all applicable policies, possible shipment damage, and compliance with specifications in the purchase order. For the installation and commissioning, they are needed from the suppliers, but the in-house technical staff should also monitor this process. So where can things go wrong? If we have a substandard equipment, implants, and consumables, not honoring the guarantee or warranty, not giving the on-site repairs, charging for the spare parts or services in guarantee period, mechanical, electrical, electronic software malfunction and non-function. These are all the problems that we can suffer from. So another problems may be the direct damage due to the equipment failure, old software malfunction, replacement and reinstallation in that case when the company charges you, unsterile consumables, equipment or expired drugs or consumables and equipment delivered, creating discrepancy in bill and actual goods. All these are practical situations which we face. So what can be done in these situations? First, we have to do a written communication with the company, and we will try to solve the matter there. If it is not working, then we can send legal notice, we can file a consumer case, we can file a criminal case if the patient is damaged, we can file suit for breach of trust, and we can also spread the news on association level, digital, social, and print media. So who is potentially liable for defective medicinal products? The primary responsibility is on the manufacturer or importer of the product. If the defect arose later on in the distribution chain, such as during storage or transport or distribution, the relevant person or entity responsible for the process can also be held liable. But we have to be aware that it is a common practice for companies to indemnify themselves against potential claims by way of contract or to obtain insurance to protect against such risks. So where are the liabilities of the companies? They can be negligent, they can do a breach of contract, there can be deficiency of service, there can be breach of conditions of license, and the drugs and cosmetic rules have been amended so that the marketer of the product is also liable for defects from 1st March 2021. So how can a product liability claim be brought? The limitation period depends on the area of law. For a criminal action, in most cases, there is no period of limitation. But for a civil action, the general period of limitation is usually 3 years. And for consumer disputes under the CPA, the limitation period is 2 years. Now, where to go and to whom to go? The Drugs and Cosmetics Act allows a consumer or recognized consumer association to send any medicinal product to a government analyst and to receive a report of the analysis. A consumer can raise a complaint with the drug authorities who, after verifying the complaint, can bring an action against a manufacturer or importer of a defective medicinal product. A consumer can also approach a consumer forum and bring a consumer complaint for defective goods in the case of defective medicinal products or deficiency of services in case of deficiency at any stage of the distribution channel. The CPA clearly provides for instances in which the product manufacturer, seller, and the service provider would be held liable in case of defective goods or deficiency of services. So what are the remedies for us under CPA? To remove the defect from the goods or services, to replace the goods with new goods of similar description which are free from any defect, to refund the price of the goods along with interest, to pay compensation to the consumer for any loss or injury suffered by the consumer due to the negligence of the opposite party, to withdraw the hazardous goods from being ordered for sale, to cease manufacture of hazardous goods and to desist from offering services which are hazardous in nature, to pay such sum as determined by the consumer forum for loss or injury suffered by a large number of consumers who are not identifiable conveniently, and to require one party to pay for the legal cost of the other party. So how will you take protections? It is always better to buy insurance for equipment purchased and never deal in cash without bill for concessional rates and show in IT return and claim depreciation. So buying is an art, and be wise, be cautious, and be honest. Thank you so much for hearing. Next, I will call our Chief Instructor, Dr. Jayanta Kuila, to deliver his talk on how to protect yourself from the hands of CPA.
Thank you, Dr. Shumona Chatterjee, for your interesting presentation. And now it will be the Chief Instructor, Dr. Jayanta Kuila.
Good morning, everybody. The armor of God, how to protect yourself from CPA. There is no financial disclosure. Corporatization and commercialization of medical profession. Against the spirit of Hippocratic oath. So doctors are no longer regarded as infallible and beyond questioning. Well-publicized malpractice case can ruin the doctor's career and practice. The best way to handle medico-legal issues is by preventing them. Negligence by doctors has to be determined by judges who are not trained in medical science. So the level of negligence depends on the entire context, the place, the time, the individuals involved, and the level of complications. It is important, error in judgment is not a negligence if it is recognized promptly and remedial actions is taken. But failure to do so tantamount to negligence. The duties which a doctor owes to patient, whether to undertake the case, what treatment to give, and administration of that treatment. A breach of any of these duties gives a right of action for negligence to the patient. Victim can seek one, compensatory action, punitive action, disciplinary action, or recommendatory actions means lodging complaint before the National or State Human Rights Commission seeking compensation. Common errors in medical profession. Patients sue because of feeling that they are not heard, that their needs were not attended, and that nobody seemed to care. As a result, bad outcome resulted due to a mistake or negligence. So most important is communicate clearly and effectively. Ensure your patient understands their diagnosis, treatment, and medication. Failure to diagnose. Number one reason, a physician gets sued for medical malpractice. A techno-savvy patient may give or explain or ask more information, or patient may withhold the information and make diagnosis difficult. If a certain complication is a known risk, it should be on the consent form for the medical procedure. However, the consent form need not list every single complication that has ever occurred for that procedure. Be aware of all medication that patient is taking, including over-the-counter medication and alternative medicines. If patients feel any medication is not having its intended effect, they should immediately contact their physician and avoid handwritten prescriptions. So inadequate follow-up. Patients do not follow through the test as directed. Needing better follow-up involves referral to specialists. Every step has to be documented not only to prevent medical legal issue but also for good patient care as well. So prevention is most important. So compassionate gestures count, so never avoid your patient. A time spent allowing the patient to fully explain his or her concern determines the physician's ability to show concern, empathy, and likability. So the longer quality of time a physician spends with the patient, the less likely will that physician be sued. Always to do the best and apologize. When physicians are honest about medical errors and apologize to the patient, the overall cost of medical malpractice is reduced in the end. One should refrain from blaming other healthcare providers for adverse outcomes. So that one must follow the proper clinical guidelines systematically developed nationally and globally to assist clinical decision making. So please practice of evidence-based medicine. They can be seen as normative standards and are used as explicit standards of care at the time of index clinical event, and also to assess the degree to which questionable practice was in line with accepted standards. Physician needs to stay up to date with the latest continued medical education programs, conferences, workshops, and symposium. Often patient may discuss what is in the social media. The ability to discuss about those news with your patients will reinforce their confidence. Another most important, informed consent and documentation. Always follow the proper surgical protocol, detailed notes of operation. Always sign along with the OR nurse in prescribed format for every operation. During surgery, if find something unexpected, it is advisable to explain your plans to the patient party before proceeding further. Always check pre-anesthesia assessment records. Correcting medical records is permissible, but fabricating or manipulating is both illegal and unethical. And if found by court, the consequences are disastrous as the doctor loses all sympathies of the court. Avoid stress. While in the midst of malpractice case, one needs to stay focused on other areas of your life. Obsessing over the case should be avoided. Hospital policies. If the physician follows proper hospital policy regarding treatments and protocols, they are less likely to get into trouble. If diverted from regulations and hospital rules in managing the patient, the facility is less likely to defend. Two types of professional indemnity, one personal and another is errors or omission policy, covers on institution along with its staff member. Not only does a malpractice lawsuit reduce the physician's ability to make a living in medicine, but also it can adversely impact or devastate both earned and invested asset. Not everyone who sues has a case. In case of medical negligence, the patient must establish his or her claim against the doctor. A doctor can be held liable for negligence only if one can prove that he or she is guilty of a failure that no doctor with ordinary skills would be guilty of if acting with reasonable care. A reasonable doctor should consider every patient as a potential litigant. So always stick to a standard of care and avoid any adventurous attempt. So what is contributory negligence? If the patient refusing to carry out the treatment recommended by the doctor or indulging in activities forbidden by the doctor further exacerbates the damage. When there is negligence of two or more persons towards the patient resulting in a particular damage, it is called composite negligence. Media trial, a doctor cannot become a victim of malicious or defamatory reporting. A doctor should not be silent and should rebut the allegation. Doctor can take help of the professional association to convey the facts and supports to resist a trail of media. The Supreme Court has warned the police officials not to arrest or harass doctors unless the facts clearly come within the parameter laid down in a case. So at the end, practice is like driving through an accident-prone highway. Make sure that there is a competent driver. That means stay within limits of your expertise. Ignition means informed consent is working fine. Engine oil and fuel means documentation or medical records are enough for the journey. And GPS means communication setup done. And brakes know when to stop, working fine. Thank you.
Thank you, Dr. Jayanta, for your excellent presentation. Being a director of 2 hospitals in West Bengal, he has almost covered the entire topic of today's IEC. So the next presenter will be Dr. Purban Ganguly, expert oculoplastic surgeon from RIO. He will be presenting his talk on the battle of integrity, facing the physical, mental, and social media harassments.
Thank you, Dr. Kuila and other faculties for giving me this opportunity. Now, how to handle the harassment. I will begin with this thing that all statements that are given against us is not destructive criticism or harassment. We have to differentiate between a constructive criticism and destructive criticism. Constructive criticism will be specific. A person will say that this thing needs to be done, or this is where I have found that it is not up to the mark. It will have a balance. The statement will contain something positive about you or your institution and something negative about it also. It will be suggestive. There will be suggestions for betterment. I think that this should be done for a better patient care. it will be time bound, not that something happened 2 years or 5 years before, patient is coming and putting it on social media that this doctor has dealt with me. That is a destructive criticism. It will be immediate. And there will be no individual focus that this staff has done this thing to me. It will be a kind of a generalized thing. And it will be goal directed. The person wants you to improve. So first thing that we have to decide on, that if someone is not with us, is not necessarily against us. And if we find a criticism, all criticisms are not harassment. And if we find that a criticism is not making me happy, then we should not have a knee-jerk reaction always. There are different types of harassment. We will focus on civil and criminal and cyber harassments only. Now, what is a civil harassment? Someone is stalking you. He's following you everywhere, wherever you are going, or standing in front of your hospital with no purpose at all. Sublime threats. Okay, Dr. Saab, thoda kam kar dijiye. I stay near your place. I can help you. If you are not doing that, then there might be situations. Nagging. There was a patient who was a beggar. I was supposed to perform a DCT for that patient. The patient was convinced that he will get it done in the private hospital, and for a very nominal fees. The patient came at the time of 6 a.m. and sat in front of the hospital and ultimately got the DCT done. The violation of modesty, this is mostly for women, and undue attention. For all the civil harassment cases, if you feel, you can have a restraining order from the court. Criminal harassment may be mental, may be physical, and may be cyber or social media. Mental harassment, you can get a threat call, you can get a message, it may be a political pressure, it may be a hierarchical pressure, especially in government jobs, it can be a face-to-face threat. Now, if it is a mental harassment, all calls, we get calls from every patient every time. We are very irritated about the calls, but we have to remember that all calls are not harassment. What will tantamount to harassment? If somebody is annoying or threatening you, if somebody is making a statement or comment that is offensive, if somebody is not revealing his identity and continuously asking you for this kind of medical help or that kind of financial help, or someone is abusive. So if we are getting a call or a mental harassment case, what should we do? First thing, let the patient go out of your room, or ask the patient that I will call you back after 5 minutes. Then start a documentation, digital preservation of the call, or make it under video recording. Do not use counter threats or do not use abusive language against the patient. If you are using abusive language also, then you are also at a fault, at the same fault as the patient is doing. He can also say that you are mentally harassing him. Politely drive the conversation. Make the patient say the threat again and again. What will you do if I don't do this? What will you do? Make the patient say it, make the person say it again and again. And make the person reveal his identity, that I am this, who are you? Tell me your name. Or which patient you are relating to, which patient you are talking to me. So these are some things which need to be done. There are, you can lodge an FIR for mental harassment. There are different IPC sections of which a mentally harassing person can be tried and brought to justice. Now, this is very important, physical harassment. This is a prevention of violation against doctors, medical professional and medical institution bill, which was done in 2019 after the NRS case specifically. And this has been amended in 2022 with the new name, Prevention of Violence Against Healthcare Professional and Clinical Establishment. Always, when there is a physical violence, always try to put in under this act, because the importance of this act is all harassment under this act is cognizable, non-bailable, triable by a judicial magistrate of first class. So you can have the lower courts can be bypassed, and it should be investigated not by the local OC, but by not below the rank of a deputy superintendent of police. Now, physical harassment in this law, there are certain terminologies which we need to know. Healthcare professional, anyone, even the ASHA worker, even the social worker associated with your hospital, even the I-bank personnel comes under the healthcare professional. Property, any property, movable, immovable asset of the doctor himself, it can be his own personal asset, or it can be a property of the hospital. Even medicines that are stored in the pharmacy of your hospital comes under the definition of property. Clinical establishment, the term clinical establishment in this act defines anything, any clinical establishment, even a pharmacy store, even anywhere where you are providing any kind of medical service to the patient. And violence, this term violence does not necessarily mean someone who is coming and beating you, but someone who is abetting to the violence, someone who is obstructing a medical professional from disbursing his duty. I will sit in front of your chamber and not let you see any more patients if you are not giving in to my demand. That is also violence under this act. So previous act had got a very diffuse kind of penalty, but now the penalty is very, very specific if it is a non-grievous hurt, if it is a grievous hurt, or if it is a grievous hurt, don't think that the compensation will be at 10 lakhs only or 10 years of imprisonment only. There is an additional clause provision that as per degree of harm inflicted, it may be decided by the competent court. Property damage, an amount equivalent to twice the amount of fair market value of the damaged property has to be given. So these things need to be there in your hospital displayed. And non-payment clause, if the person is unable to pay it, it will be as an area of Land Revenue Act, the next to kin has to keep paying that with interest. So physical, but don't think that at least in India, all laws will be in favor of the doctors. In the law itself, it has been said that there is a responsibility that these things need to be taken care of. Do not wait for long. All documents should be given to the patient, not that your next appointment is on such and such with such and such doctor, so that the patient can have a second opinion. No information asymmetry to the patient. One patient you are telling a little more about the surgical procedure, the other patient not, that is not. Have an appropriate grievance redressal system. There should be a grievance cell in the hospital where the patient can go and vent out. Have a liaison with the police. Transparency on the rates of, now this is a dicey situation. These are the loopholes where the patient party can, make a claim that the rates were not transparent. What kind of transparent rates or standard rate is there for a phaco surgery? We are yet to decide on that. Sensitize the public that the people, healthcare personnel are under constraints, and change the curriculum of the medical education. It has changed. Now ATCOM, that is attitude, communication and ethics, is a very much important integrated part of undergraduate medical training. So they are telling that to keep an explanatory note. This is nothing but a consent form in detail. These things should be there in, and most important is that when the patient is signing the consent, or the consent is being explained to the patient, that should be under a CCTV coverage with at least 2 minimum attesters, or who will sign the consent along with and is as a proof that this thing has been done. But this can be avoided in case of, if it's an emergency, you can avoid this. What is social media harassment? This is a very important thing. Half the time we are not aware that we are being harassed, or we are unnecessarily bothered with a social media thing of which we should not bother at all. So these are the few forms. I will give examples of each. Cyber stalking. What is cyber stalking? It is mostly done in case of female doctors. You find the patient or the concerned person is seeing your WhatsApp update for a number of times. He has been visiting your social media profile for a number of times and making comments which are not lewd, but everywhere you find that person present. What is catfishing? This is very important. Catfishing is that I have a profile, and with my kind of obesity, I'm not finding a suitor. I have placed the picture of Salman Khan in front of my social media picture, and I'm identifying myself with that picture. I'm not telling myself that I'm Salman Khan, but I am a new person with someone else's picture or someone else's property. That is catfishing. Online impersonation is very common. Even 2-3 days back, we had a case where the phone was lost, and a WhatsApp call was given to 2 people to transfer money, and telling that I am in distress, please transfer, with a message. So online, half the time the doctors are getting their Facebook profile hacked. So this is online impersonification. Doxing. Doxing, I'll give an example. Doxing is, suppose there is a center and a doctor, he's using a software for his prescriptions and all his appointments and all that. The software company comes and tells him that, sir, are you happy with this? So please give us a comment that you are happy. Now the doctor has given the this thing. Now this company, social software company, is publishing it in the social media platform and elsewhere, that see, this is our software, this software is being used by this doctor, he has got 5,000 patients have gone through this software, these are some of the star patients who are happy with the doctor with the help of our software. This, if done without your consent, then that is doxing and it is a cyber harassment. What is trolling? Trolling is an example that a person is purposefully making absurd, lewd remarks on your social media platform. There is a case that a child of a established ophthalmologist had posted a picture, had drawn a picture of Shiva, but he's a 5-year-old child and he has posted it in the social media, and they are continuously putting adverse remark, one person continuously putting adverse remark with that picture. So that is called trolling. All these are protected against the Information Technology Act. You need to lodge an FIR with always try to take the screenshot, or because the person might delete it afterwards. So Consumer Protection Act can give us. So how to handle, I will be very brief. Primordial prevention is very important. Prevent the risk factors. Feedback forms should be given to all patients. We have to see that there is no communication gap, and this is very important. A weekly autopsy. Suppose a turbulent incident has happened. So a weekly autopsy, discuss with your staff that why this turbulent event happened, or where can we do it. Make a grievance cell, and the grievance cell should be visible so that the person can go and vent out. Now, the primary prevention is that we have already discussed all these things. For the sake of time, I will not discuss. But it is better to nip it in the bud than to go into the tertiary and secondary prevention, which Bhaskar sir will say. We all know what happens when a doctor goes to court. So let not the doctor be dragged to the court. So I will end with this, that first thing we have to tell ourselves, we are not at war with our patients. Every patient is not potentially harassing. Services provided must be worthy of the cost incurred. If you are overcharging your patient, or even if you are maliciously trying to do all those things, then that will have an adverse effect. And let's be ready to face constructive criticism also. Thank you.
Thank you, Dr. Purban Ganguly, for your excellent presentation. Next, I'll call upon Dr. Seema Krishna Mane for Care and Cure, how to protect the interests of patients.
Good morning, everyone. Here I am going to talk about much of the practical aspects, how we can handle patient in the OPD. So before a patient knows, we should know that what are the exact rights of the patient. They have all the rights. We need to inform them about the diagnosis, treatment options, risk and benefit associated with each option in a language which patient can understand. So it has to be properly conveyed to the patient, and as we know that we have to give the consent in a language where they understand it properly. Even for a minor medical procedure like we are removing the foreign body, it's not that we will put the paraffin. Even while putting the paraffin also, we have to inform that some drop is being put in, or even putting the Tropico Plus, all that has to be informed properly to the patient. And it is very important to keep the confidentiality about their illness, diagnosis and treatment, and it can be revealed only by the law if it is necessary. Otherwise, it has to be kept confidential. And obviously, if there is a female patient, there should be always a female healthcare provided for all the male doctors. And during even a OPD consultation, while we are performing any procedure, and all the patients should be treated respectfully regardless of the gender, race, religion or a social status. All patient has the right to choose that which healthcare provider he wants. If we have a center where multiple consultants are there, and if he asks for a particular consultant, then he should be shown to that consultant, and he can actively participate about the decision about his care. If we have a multiple option, then it has to be properly discussed with them. And if they want to seek a second opinion, then it is better to give them an option. In fact, if we are giving them a new treatment, or we see that they are in a doubt about our treatment, then if we by ourselves give them that you can go and show to some other consultant or some other specialist, they will feel more of trust on us, and obviously we have to give them a quality care. They have all the right to complain without the fear of retaliation. It is better to keep a complaint book, and it should be accessible to the patient, so they will feel that they are being properly treated. If any course of action is going wrong or anything, there has to be some person in your OPD, designated person, where the patient can go and lodge its complaint. We have to be properly communicating all our services. In case of whether we have to know whether the support services are offered in case of speech or vision impairment or language barriers. So it is like we see patients from different areas, so it is better if we give them some other options where we can help them with these language barriers. And in the right to transparency in transaction, if they ask for a receipt even for a minor procedures, we have to give them receipt in all cases. Right to pain management and transfer and continuity of care. Unless patient has been explained clearly why they are being shifted to the another ward or hospital, they have right to stay exactly wherever they are. And we have to be continuously seeing the patient, that if they are having a pain, like many of time what happens post cataract surgery, that everything is fine but they have a pain, then we have to treat. In the corneal ulcer also, we give all the antibiotic, all the antifungals, but we don't give a simple painkillers. Then it has to be properly given to the patient. But along with that, the patient responsibilities are very important. Providing accurate information about their medical history, their current health status, and any medication. Obviously, patient is not going to tell by themselves. We have to give some questions to them, but it is their right, their responsibility, that they should convey us all the information properly, and they should follow our instruction. We are not the God that if they see us they will be better. They have to follow our instruction, taking proper medication as prescribed, attending the appointments and following any. So this has to be told by us to them also, that you have to do all these things. So their responsibilities they won't understand, but we should convey them properly. And they have to respect healthcare providers, including all our staff from the down workers to the up, and treating all the healthcare providers with the respect, dignity, refraining from the verbal or physical. See, these are the things where we should limit them. If they are like becoming violent to us, and then there should be our attitude that this cannot be beared by us, and we have to be particular about them, and they have to take care of their personal belonging. We are not responsible for any loss of their belongings in our setup. And paying for services, yes, many time patient ask that last time आपका fee था 500, अभी 600 क्यों किया. So in that cases you have to take that tell that this is what service you are providing, and you are taking charges for the service. It's not something like a bhaji market where they can do this. And this happen with many of the private practitioners, that you come down. That if they say, okay, last time you charge 500, then we say, okay, you give 500. No, you have to be at particular time that they should pay for your service. You are giving them a service. And then coming to the emergency care, yes, triage in ophthalmic care is also important when there are multiple casualty events happening near to your hospital, like where there is an immediate and life-threatening things are happening. Your hospital should have SOP with the multi-speciality hospital. There should be an ambulance care or ambulance number with your hospital, so that you can refer this patient immediately to the nearest multi-speciality hospital. The triage too will include the treatment which has to be attended within 10 minutes, like the chemical burn where you have to immediate give the wash. no treatment, first give the wash to the patient. Penetrating eye injury in CRAO, where there is a sudden vision loss, severe eye pain, endophthalmitis, acute angle closure glaucoma, and the other treatments which can be dealt in within 30 minutes, like painless loss of vision, like CRVO, total hyphema. Though we don't do so much of delay, but these are things which we should also know, because they are going to help you somewhere in the court of law. And the assessment within 60 minutes, within the 1 hour, like foreign body, non-penetrating injury, painful red eye, flash burn, because it will have pain which is most delayed, and there is a sudden increase in flashes or floaters, especially with previous RD, small hyphema, blood in front of the chamber of the eye. So this is the trial system for the ophthalmic services, which many of us are not aware. And assessment and treatment can be done for 2 hours, like conjunctivitis, blepharitis, chalazion, dry eyes, long-term history of floaters. See, these are also the cases in private practice. We don't make them to sit 2 hours. Like in our practice, if any patient with the red eye, we deal it first, because these are the patient which will make a chaos, and they feel that they are very emergency patient. But usually you can give them treatment within 2 hours. And when you are in OPD, it is better to flash somewhere that overall your ophthalmic treatment is going to take minimum 2 hours of treatment. So it will prevent you from many of the hyper patients. They want to be a very VIP treatment or something. The actual VIP patient are these vulnerable patients. They are in the specific group, like more than 80 years of age, less than 10 years of age kids. They are running from here and there. So physically and mentally challenged patients with complete or partial loss of the vision, comatose patient, usually they won't come to you, but in case they come to you, then, and thus patients with activities of daily, like they are unable to do the activities of daily living, limited physical mobility or impaired mental function, impaired communication or language problem, impaired bladder function. This is very important. The washroom facilities has to be accessible to these patients, pregnant women. So all these vulnerable patients, they should never be left alone. Some staff should be always continuously monitoring them. Tell your staff or give training to your staff. They have to be very patient with that these vulnerable patients. Their special requests should be always respected. The railings, the bars in the toilets, the wheelchair stretchers, these are very, very important, because this is going to create some impact on how you are carefully handling them. And always mark V stands for very important, or VIP patient, for fast service at each step. So these are the patients which you actually should attend them first. The child abduction, code pink, it is very important again, because in a busy OPD you may not be aware, but if all the children, their parents has to be continuously with them, they should take care of their children. But in case any child abduction happen, then all staff has to be alert, unusual behaviors, they can question anyone. There should not be any unauthorized person. So these things are very rare, but there is something called a code pink, and there you have to secure the entrances and exits, and every 5-minute announcement has to be done, similar like a code blue. Thank you for your attention.
Thank you, Dr. Seema, for your excellent presentation. Next, I call upon Dr. Shumona Chatterjee. What the body and accreditation is, accreditation status helps in preventing litigations.
Actually, this topic, because we are all getting NABH accredited and all, so we know what are those and what are the benefits of accreditation. I'll just highlight the headlines that they have. That they have the policy and procedure on scope of services, registration, initial assessment, lab services, safety program, care of patients, continuous quality improvement, hospital infection control, which is very important, facility management and safety, human resources management, information management system, management on medications, the similar looking medications, how should not you confuse amongst them, patients' rights and educations, what Seema just now discussed, and the responsibilities of management also. The thing is that this kind of accreditation doesn't give you any extra protection in the court of law. But if one is accredited, it helps to establish one's credibility as it becomes evident that you are following all rules and regulations. With that, I will end my presentation and I will invite our star presenter of this IC, Dr. Bhaskar Mukherjee, sir, to give us tips and advise us how to face the court. Please.
সরাবো কি করে এখানে ক্লিক করে আচ্ছা এটা ক্লিক করলে না না দাঁড়ান এটা করলে গেল আর এদিকে করলে ঠিক আছে এখানে করে ঠিক Good morning, ladies and gentlemen. It's a privilege and honor to be present here this morning. Initially, I'd like to thank AIOS, Dr. Jayanta Kuila, and Dr. Shumona Chatterjee for inviting me in this IC. So I don't have any financial interest in this presentation. So that's the symbol of the Supreme Court of India. And little bit of glossary. CPA means Consumer Protection Act. MLC is medical legal case. Plaintiff is the one who takes the case to the court. OP is the opposite party. Here, the doctors are the opposite party. A summon is an order to attend the court. Res sub judice, that is, when the litigation is awaiting judgment. Contributory negligence, patient lost to follow up or refusing treatment leading to complications. IPC is Indian Penal Code. CRPC is Criminal Penal Code. So that's my experience with judiciary. As a medical superintendent, I had defended my organization twice at the State Consumer Forum successfully. Once at the West Bengal Clinical Establishment Regulatory Commission through arbitration successfully. And in a personal level, I have fought ejectment suit in Shialda Civil Court from 2008 to 2019 and won it. And I'm well versed in facing cross-examination standing in the witness box of the Defense Counsel. So ophthalmologists can be called in a court in 3 cases: as an expert opinion, as a witness giving evidences, as a defendant in consumer court with advocate, to face the arbitration in West Bengal Clinical Establishment Regulatory Commission, where the advocate is not allowed, doctor in hospital administrations are called upon, and summon must be obeyed. If disobeyed, civil case, you have to pay compensation. In criminal case, fine or imprisonment is there. So common medical legal cases in ophthalmology. Mainly it's cataract surgery related complications or surgical complications, then it's PBK, it's globe perforation, RD, negligence in post-op checkup, endophthalmitis from anti-VEGF injections, untimely diagnosis of ROP or glaucoma leading to blindness, complications in camp surgeries where there is cluster endop, eye trauma, fist injury, road traffic accident, but the dangerous is death in OT or death after an anaphylactic shock. So medical negligence, what the court wants to see is whether the doctor has exercised reasonable degree of care and skill. So an ophthalmologist, you will be surprised to know that an ophthalmologist is answerable to all the courts, from district, state to Supreme Court, to all the consumer forums, district, state to national, state medical council, national medical council, apex body in case of ophthalmologists, it's the RIO if the case goes there, to the social media, to press, print, electronic media, and to police. So how to face the court? This is the topic. So the more you sweat in peace, the less you bleed inward. That is, good documentation leads to good records, leads to good defense. Judiciary goes by hardcore evidence and factual details and not by emotion or sentiments. So how to face the court? Again, I said preparation is the most important thing. Execution should be through your legal advisor and firm. Please, please, please break this myth. I am paying a very huge premium. My legal company will take care. No. A strict no. A legal company fellows, they don't know anything about medicine, neither about ophthalmology. So you have to prepare your own brief. And while preparing, please highlight the points. And while you're making a copy, you have to first copy the question raised by the opposite party, then you give the answer. And again, never waive off your bills, professional fees, because the court becomes suspicious. Court doesn't want you to do a philanthropic job. They expect you to be a professional, so you have to charge your bills. Never perform a procedure without consent, and never allow finance to control your medical decisions. These are the clauses, are the IPC sections which we use for doctor's defense. Mainly, it's almost the same, that I've done a procedure which was good for the patient with consent, but something went wrong, that was an accident, and there was no intention to harm the patient. And to prove that it was a right procedure, you have to prove it through Boehm's test, that is by giving evidences. So these are the two decrees that we always take for doctor's defense. Kusum Sarma versus Vatra Hospital, where it is said that negligence has to be culpable or gross, not error of judgment. Not getting desired result is no negligence. Difference of opinions is no negligence. A doctor is liable only when his conduct fell below standard of reasonably competent practitioner in the field. And this, as already mentioned by my previous speaker, Honorable Judge Markandeya Kadzu's judgment, that whenever a complaint is received against a doctor or a hospital, the consumer forum should send it to the medical committee before issuing notice to the opposite party. Police must not harass or arrest doctors unless proved otherwise. And there is, So how to face the court? Never rely completely on your advocate, legal firm, professional indemnity company. Prepare your own brief. The first reply has to be rock solid, because you have to negate all the allegation points. And in case of hospital problem, always make an inquiry committee comprising of 2 doctors and 1 from the administration, because the court will want to see whether the inquiry committee has been made or not. Again, this I'm requesting all surgeons present here this morning. Please, if there is no case or if there is a case, regularly keep these records ready in your hospital. Swab culture report of your OT, wall, floor, microscope, instrument box, monthly, aerobic, anaerobic. Please prepare it, because the court wants to see whether your OT was sterile or not. Again, autoclave book and sterilization logbook. Somebody who is doing it, signed, date, every day. Please keep it ready. A job is not done unless it is documented. That's what the court say. Never overwrite or tamper your documents. And Boehm's test, submit enough textbook, journal, internet documents in your favor as evidence. Wikipedia is not accepted. When the complaint has been lodged by the opposite party, that is the plaintiff, search for the treatment record for defaulter, loss to follow up or non-compliant. This is tantamount to contributory negligence. Check all documents submitted by the plaintiff over writing, tampering of facts. If proved, litigation will not be sustainable in CPA court. It will be a criminal case. Never answer phone calls, text message when the litigation is sub judice. Avoid out of the court settlement. How to face the court? This is the practical thing. Execution. Your attire has to be formal. Always stand up during entry and exit of the honorable judge. Never sit cross-legged in front of the judge. No need to say bow or say my lord. That's a colonial culture. A namaste or sir, madam or namaskar will be enough. In witness box, there is no provision of "Main Gita pe haath rakha saugad kar." No, that's all in the movie. Okay, that doesn't happen in personal life, in professional life. Always carry an ID. Okay, and don't be nervous. As an expert witness, you are present to assist the court. You are not accused. So always your answer should be brief to the point, depending on the records. If you don't know any particular answer, say from the available records, I cannot say anything definite about it. After your deposition, the subject matter will be given to you. You can check the spellings, but you have to sign by the side of it. You cannot change the abstract form, and show respect to the court before leaving. And if you're an expert witness, you can ask for TADA. So what is the judge's point of view? Did the doctor fulfill his or her duty? Did the doctor provide a standard care? Was the incident foreseeable given the nature of the incident and training of the doctor? Did the incident cause the patient harm? And did the harm cause financial damage to the patient? In WBCRC, it's more or less the same, but there is no, advocates are not allowed. Doctors in administrations are called about. They usually look after the logistic problems, and submission is either in Bengali or English. And again, be careful while talking over phone. That is usually given as a recorded evidence, and serve copy of your documents to the plaintiff. So the take-home message, this is the last slide. Never take complaint personally. I have seen in my career that doctors become upset. Oh, I've been practicing for so many years diligently, and now having a complaint. Anybody in this planet in this country can lodge a complaint against you. So don't get emotional. Accept it as a part of the system, just like a sportsman. A sportsman can't say that I will never have a sports injury. Similarly, doctors now practicing in India can't say that there will not be any litigation against them in the career. But a litigation doesn't mean that you are at fault. So prepare your defense from consulting books, journals, internet, your seniors, your advocates, and professional indemnity company. Always keep good rapport with your colleagues. Maintain MLC register. Always provide first aid to your emergency patients. Onus lies on the plaintiff to prove that they were negligent. And remember, complication and negligence is not same. Admit complication, but always defend negligence. The last point, this is from the aviation industry. I have seen old pilots and I have seen bold pilots, but I've never seen a bold pilot getting old. So always play safe within your jurisdiction. Thank you, ladies and gentlemen, for your patient hearing.
Thank you, Dr. Mukherjee, for your excellent presentation. I'm requesting you just to discuss the previous 3 cases in previous slides, and what will be the decision about these cases.
আপনি ইয়ে করতে পারেন, মানে জাস্ট এই কথাগুলো বলে দিতে পারেন, এরপরে আছে কেস বাই কেস ডিসকাশন।
Oh, this is the case. I mean, I have gone through the cases, except the first one. The other 2 cases are not sustainable in a court of law. Here, suppose I'm defending. Suppose I'm defending this doctor or this hospital. I will show you the mistake that the doctor has made. It's not about biometry. The moment I see that -6 diopter spherical has come after surgery, I will inquire whether how many cases underwent biometry on that same day. If I find that now 9 out of 10 patients, 9 were satisfied, I will then defend my organization or my doctor by writing a letter to the lens company saying that the lens which was inside the box, it was supposed to be -21 diopters, but the lens was probably -14 or -16. That's how I will defend. The problem that the doctor has made or the hospital has made, option for IOL exchange at no extra cost. Don't do this. You always charge. You always say to the patient party and the patient that you have to pay this amount of money for this, the second procedure. Now, you will say they will not pay. They are annoyed, they will not pay. What will they do then? You will ask them to give it in writing. Even if they don't do that, ask your account head to generate a bill and then give a stamp and write that the payment was not given by the patient party, and keep it in your record and submit it in the court. The court always becomes suspicious if you do anything without any charging any fees. Don't do this. That means you are at fault. Number 2, this is, I mean, you can usually negotiate it. You can ask the patient party, okay, you are satisfied with the second refraction, you give me the glass. With that same frame, I'm going to change the glass power without going into any legal hassle. And the last one, this is not sustainable. Please refer to IJO 2017, Dr. Tara Prasad Das, Savitri Sarma, Subhasya Sengupta, and et al. Paper on endophthalmitis. Out of 7.5 million surgeries in India, India loses 4,000 cases per year for endophthalmitis. It's a recognized complication, and complication is not negligence. And if the created rucksacks are happening, we will ask the court to order 144 and prevent your hospital. Thank you.
Thank you, everyone. And we are concluding our session. Thank you.